Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference on Delaware's response to COVID-19. I'm joined again, as I am each week, by Dr. Karyl Rattay, the Director of the Division of Public Health. She and her team are just doing an outstanding job responding so many tasks that they have to do. We have some important updates that she's going to bring to us today around our progress in vaccination, a very big and challenging exercise. Every state is facing it, and we expect to see changes coming from the federal government. In fact, there's a governor's call right now while doing this press conference with White House Task Force, on which I expect that we'll hear additional information about supply that states are getting. It's been somewhat uncertain from the beginning. We also are joined by Schall, the Director of the Delaware Emergency Management Agency. He and his team are just doing an extraordinary job with testing. You'll remember that our goal for monthly testing rates was 80,000. I never thought we'd meet 80,000. We've blown way through 80,000, and over the last month are on the 200,000 and 200,000 plus number of tests done, which enable us to have a better idea of the spread of the COVID-19 in our community, to identify hot spots, if you will. And Dr. Rattay is going to talk a little bit about that, as she always does. And so AJ's team, and particularly their partnership with Curative, which is a health testing lab that is now doing vaccinations. We'll talk about the possibility of a partnership with them in scaling up vaccinations here in Delaware. Just some really extraordinary work. We have our contact tracing team on the field as well. They have staffed up to meet the increased number of positive cases and the contacts that have to be made to protect those who may have been exposed to somebody who's COVID-19 positive. We continue that effort as well. We are in the midst of the kind of second surge that we've seen after Christmas and the New Year's. All the experts expected it to come. Hopefully we'll be able to, it won't be as bad as it could have been. We've reached a peak, as we'll see in a minute, in hospitalizations today, which is something that we look very closely at. But on our hospital call yesterday, each of the hospital systems gave a level of comfort that they're able to meet the surge that they're seeing in their hospitals. They've been able to reduce elective surgeries and other procedures to make room for those that are coming into the hospital with serious COVID-19 symptoms. They're also helping with the treatment monoclonal antibodies. I always have a little trouble with that, which is a very effective treatment and a mechanism for preventing elderly patients from needing hospitalizations in the first instance. This week, we have almost all the school districts across the state have brought children back into the classrooms in a hybrid kind of fashion, and I want to thank them for all of that. Thank the educators, the teachers and staff in the schools for their incredible efforts over the last 10 months in remote learning, in hybrid learning, in learning where they have children, some children in the classroom and some coming in remotely. For parents and child care workers who are working with the remote learning arrangements that they have with their school districts and schools. We know that every day is a precious day of learning, particularly for our younger children, all children, but those children learning to read that can't afford to miss a day, let alone months at a time. So thank you goes out and appreciation goes out to all the teachers and educators in the districts up and down our state as we bring children back into school. I've already heard anecdotally from parents about how excited their children were to go back to school today. And I know teachers are excited about that concern for sure. And that's why we've worked so hard with educators and staff over the last 4 months to create a level of comfort there. and to try to put into place mechanisms that we can respond appropriately as need be. So a lot of testing, a lot of efforts to get people to follow the social distancing, mask wearing going on. I would just call on all Delawareans to continue to follow those mitigation efforts, stay at home, only venture out when necessary. We're through the holidays now. The light is at the end of the tunnel. The last subject and most important probably to talk about today is vaccinations. We're ramping up our capacity through our primary care physicians, through the hospitals, getting our 1A healthcare workers vaccinated, ready to move on in another week or two to the 1B essential workers and those 65 and older. So just be a little bit patient. We're getting there. We're going to ramp up quickly. We're going to move quickly with some mass vaccinations centers with our partnership with Curative. I remain optimistic about that with our core partners of primary care and pharmacies. Pharmacies are got a great network across our state. They know how to do this. We need to make sure people get registered so that they get in the Delvac system so we can make sure they get the second dose and we can keep track of who gets vaccinated and who doesn't. For those of you who have vaccine hesitation, everything we've seen so far has been very positive. Some, effects that Dr. Rattay is going to talk about that a very small minority have, but we would encourage all of it, particularly those frontline workers, to make sure that you get your vaccine and take advantage of the opportunity that you'll have at the various venues over the next several weeks. The president-elect, our own Joe Biden, has made it very clear he wants to increase the number of vaccines available to states, and we've got to ramp up to meet that additional supply so we can move people through and get vaccinated as soon as possible. The base and the foundation of that is continue to be primary care, healthcare providers. We continue to have a strong partnership with the hospitals, and they are vaccinating their own personnel there as 1A workers and partnering up with us. Hopefully it's at a meaningful level to do other healthcare providers in the community and on to regular citizens after that. So let's move over to the data dashboard to start off, and then we'll go to Dr. Rattay to talk about vaccinations and to AJ to talk about testing again. Can't forget testing. That's critically important now as we flatten and push the curve on new positive cases as we try to reduce new hospitalizations. Let's look at the data. So we're closing in on 1,000 total lives lost, everyone, a precious one, 66, almost 67,000 total positive cases since that first positive in early March. And hospitalizations, the thing that we can compare most reliably between our experience in the spring and our experience here recently over the last couple months is the effect, the seriousness of the illness that results in somebody seeking hospital care. We're up to a high point of 473. That compares to, I think it was about 337. We'll see that in a minute back in the spring. So clearly the high water mark for hospitalizations. Let's look at the breakdown by county in terms of positive cases. In Newcastle County, we're up to 38,000 positive COVID-19 cases since last March, 10,000 positive cases in Kent County, and in Sussex County, 17,000 positive cases. We are seeing a bit of an uptick. I think the last report or two, things were looking better in Sussex County. Now we've seen some trouble spots in Sussex County, so we'd ask our neighbors there in the lower part of our state to be cognizant of mask wearing and social distancing. The hospital systems down there are still, they are at high water marks in terms of COVID-19 patients, but at a level that they can handle at the moment. Let's look at the number of tests. If you think about increasing the testing from somewhere around 80,000 or below to 200,000, and having a percent positive of just under 10%. That's a big number and something that we want to flatten out. We want to be below 5%. I was looking at the report nationally last night and saw where there are very few states that have a percent positive rate below 10%. We would like to be one of those few, and so we would ask all of you to follow the mask wearing guidelines, stay at home, and stay out of crowds and gathering places outside of the home. We are up to over 700 new cases per day with the 7-day moving average. If you follow our daily scorecards, you've seen some spikes way above 1,000. That was due to the fact that some batches of test results came in on an individual day. Don't get too excited one way or the other about a very large number there above 700 or a very low number there. Generally, those are a function of the ebb and flow of test results that we're receiving back from the tests that we're doing. Look at that 7-day moving average. It's still too high, but we were over 800 there for a while. We're flattening out a little bit, and hopefully we'll peak out soon and head down the other direction if people follow the appropriate mitigation efforts. AJ and his team's efforts and our partners with Curative have pushed that number of total tests administered over 1 million. When you're doing 200,000 a month, you'll get there and get there pretty quickly. And you can see that compares to just over 500,000 of persons, meaning individuals have been tested once, twice, 3, and 4 more times. The rate of positive cases, that young adult group still has the highest number of positive cases as a percentage of the population. Be careful if you're in that group. Let's look at the data that's really meaningful in terms of hospitalizations. You can see the 14-day of current hospitalizations, right? So to the peak of today, and you can see and compare the spring hospitalization rate at the end of April, where it met its peak. As we flatten that curve and reduce the spread across the state in late May, June, and through the summer, you can see the hospitalization numbers went down. I think the lowest number was under 30, and then we ramped up after Halloween and Thanksgiving to the surge that we've seen in December, and now after the Christmas, New Year's holiday. The 14-day view on positive cases, again, you see those peaks and valleys on the day-to-day numbers. A lot of that is the receiving the results from the tests on given days, and we see large numbers that come in a day and smaller numbers. But again, you can compare back in April, May. You can see those in the next graph, how different it is when you're testing 100,000, 200,000 a month. You're going to identify more people that are positive with COVID-19. Looking at the percent of positive tests, again, you can see we weren't doing the tests at the level that we are now back in the spring. And so you have a much higher percentage of positives compared to today, where you're still having a percent positive just around 10%, too high for sure. We want to push it below 5%. Here's the numbers that I was referring to earlier that you can compare more evenly, although we hear from the hospitals earlier on in this surge here in November, December, and January, where the seriousness of the illness wasn't quite as bad as was reported back in the spring. Now we're seeing more serious cases coming in as anecdotal reports from the hospital administrators this week. But you can see the run up there in the spring from 167 to 337, and then the decline over the summer months to a low of 29, and then the run up from November, Thanksgiving really, up to 306 in early December, and then the peak just this week at 473, and hopefully that will be the peak, and we'll monitor that as we go. So Some good news, the same old news about social distancing, mask wearing. That's the most important thing that you can do. Avoid social gatherings. Be careful around having people into your home from other households. Pay attention to the mitigation efforts that are in place. Thanks again to the educators and teachers who are getting more children back in classrooms, the children and families who find that to be very much more productive. Thank you for your forbearance. As we, some patients required for the next 1B group in terms of getting vaccines delivered, we will be ramping up our ability to deliver those vaccines through our partners, primary care, the healthcare providers, as well as pharmacies, employers, and ultimately our very good partner in testing, hopefully sometime very, very soon to do mass vaccinations, much like we do testing. A little bit more challenging enterprise for sure than testing in terms of data collection. There's a delay afterwards that you have to wait just to make sure there's no negative immediate negative effects. Dr. Rattay, the expert's going to talk more about that, and we appreciate the work that she and her team is doing and the partnerships with our partners in the primary care and pharmacies, healthcare, other healthcare providers, and ultimately our mass vaccination sites across the state. Dr. Rattay.
Thank you so much, Governor. So let me first start by talking about what we're seeing in Delaware this week as far as cases. So we have been seeing some increases in case rates, especially in Sussex County. So this is the first time in quite a while that we have really seen all of Sussex County light up like this. Most all zip codes in Sussex County right now, if not all, have over 500 cases per 100,000 people this past week, which is a fairly high case rate, also high percent positivity. So we saw an increase in case rate of 50% for Sussex County this last week. So this is really where we have our eyes focused right now. There seems to be a lot of infection spread in Sussex County. So again, as the governor just said, I will reiterate the importance for folks in Sussex County to get tested and to practice face covering, social distancing, and really be aware that we are seeing more spread of infection in Sussex County. That is certainly not to say we're not seeing it in other parts in the state, but by far the biggest increase over the past week especially has been in Sussex County. Let's move on to an exciting and hot topic, which is vaccines. So if you're keeping an eye on our vaccine tracker, you'll see that Delaware has received almost 59,000 doses of a combination of the Pfizer and Moderna vaccines. Also, on the next slide, when you look on our vaccine tracker, you can see that about almost 27,000 doses have been administered. That means put in arms. That being said, some of the things we've learned from our data this past week is we know that there is a delay in data reporting, and so most likely it's a good 10,000 more people have received the vaccine than the vaccine tracker is currently showing. But still, it is obviously very important that we escalate our vaccine efforts and get our vaccines to the 1A population as quickly as possible, because we're all eager to move on to 1B. So let's move on to the next slide, where I just wanted to provide a highlight of the federal pharmacy program, which is a federal program that we're really excited to partner on with CVS and Walgreens. We have about 188 facilities, long-term care facilities that are registered in this program. And of those, 42 have already received their first visits for vaccinations, meaning all residents and staff had an opportunity for vaccination. There'll be 2 more visits in the coming months, but almost all of those facilities will get a visit by the end of this month. So again, we're really eager and excited to get vaccination to our most vulnerable populations. So let me talk about phase 1A vaccination activities. A lot of activities taken place within DPH over the last week to increase access to vaccinations for phase 1A personnel. And today we are announcing plans that we're calling the Sprint to Vaccinate 1A, which are, as you all recall, healthcare workers, first responders who provide any medical care, and of course, long-term care residents and staff. So as I mentioned last week, if we, can you go back one slide, Jess? Oh, there we go. Thank you. Wanted to highlight some of the activities that have been going on, which have been a real success with a lot of good lessons learned for us. We've held now multiple events at DMV sites, and here you can see an aerial photo of the incredible response at the Georgetown DMV last week, where in 2 hours we were able to vaccinate 650 first responders, which are those who have some medically related duties, as well as school nurses and home health personnel. So we're really finding these to be successful approaches for us in partnership with EMS agencies. Our county paramedics have been amazing partners, as has our Medical Reserve Corps and DelDOT and others. And so we're really excited to expand to more of these. So if we can turn to the next slide. In addition to 3 other, we call them pods, but they're these vaccination events, and those 3 that have been previously scheduled are continuing with EMS and school nurses and home health. We're really excited to announce 6 additional weekend drive-through events at DMVs. The weekend aspect of this, going from 10 to 4, allows us to see, to get more people through. You saw we got 650 people through in 2 hours. So, we're hoping to be able to vaccinate a lot of folks this weekend. With the 2 events, we're reaching out to home health and dialysis centers and other healthcare personnel, especially those serving people with intellectual disabilities who have been on our planning list to get vaccinated. So they're all getting scheduled to get their vaccinations in this clinic. And then the following weekend, we have 4 more of these events, 2 upstate in Newcastle County and 2 downstate in Sussex County. So we're, again, really eager to get all healthcare workers who have not yet gotten their vaccination, either if not through their health system or other activities, to get vaccinated at one of these events. We also really want to give a huge shout out to some of our key partners who are operating other clinics. We hospitals, as well as our federally qualified health centers, and even dentists in our state are leading the clinics to vaccinate other healthcare workers. And it's just so heartening to see, these folks stepping up to vaccinate others in 1A. But what we want to highlight here too is there is a process to get scheduled for these. So let's move on to the next slide, where I also want to highlight some of the other exciting activities, which is now we have several pharmacies that have come online or coming online That includes this week, we have 6 Rite Aid and Camden Pharmacy who have started this week. We also have 60 Walgreens stores, as well as Giant stores that are starting next week, as well as Albertsons, 11 Albertsons, which is Acme and Safeway, as well as CVS, which is anticipated to go live on the 25th. Additionally, Giant and Walmart are getting involved and getting ready as well. So you can see our infrastructure to be able to vaccinate is expanding. Now, of course, right now, their focus is going to be 1A, but as you can see, this is preparing us well to move into 1B with all of these pieces, so that there are lots of options and opportunities for people to get vaccinated. And finally, I want to give a shout out to providers who have become enrolled, which is the next slide. We now have almost 200 providers, healthcare providers who have become enrolled to be vaccinators. And of course, that includes the hospitals and our federally qualified health centers, but also several urgent cares, a lot of medical offices, and even dental providers. So a lot of providers in our state now are not only vaccinating their staff, vaccinating other staff, but getting ready to vaccinate their patients and others when the time comes. So on the next slide, let me just mention that for healthcare practices in phase 1A who have not gotten your plan on vaccination for your staff or yourself, if you're a solo practice, please reach out to vaccine planning at delaware.gov, where we will help you find the best opportunity for vaccination. But again, we are really, really focused, especially for the upcoming 12 days to make sure that everyone in 1A has their opportunity to get started with vaccination. On the next slide, I just want to remind people, because I know that there's a tremendous amount of eagerness and even anxiety about where will people find their vaccine when it is their time. And we promise we will be releasing information to you as soon as we are able, as we are preparing to enter into forthcoming phases. So please keep an eye on our press releases, which you can get at news.delaware.gov, our general communication channels, as well as social media, but we're gonna continue to provide updates on de.gov/COVID vaccine. So our website is really key place to keep an eye on for vaccine opportunities as your phase rolls around. So let's talk a little bit about what we know about side effects from the vaccine. I'm sure many of you have seen in the news that there have been some individuals who've had serious allergic reactions. In the first week and a half of the vaccine, there were 21 individuals who received the Pfizer vaccine who had a severe allergic reaction. Now, among those people, almost all of them had prior serious allergic reactions, especially to medications, although some to food or insects, for required hospitalizations. And if you look at the total of all individuals vaccinated up to January 6th, it was 29 individuals out of 1.9 million doses administered at that point. So I know that this is something that people have been keeping an eye on, but from our perspective, this is exceedingly rare. And for individuals who have a history of allergy, all of our sites are prepared to respond to allergic reaction, but we suggest that you talk to your doctor and make sure that you're comfortable with your vaccination plan. And lastly, we just want to remind you about important steps after you get vaccinated. So unfortunately, vaccination isn't a hall pass, meaning you can just burn your masks, and it doesn't mean you can stop social distancing, and it's not a go ahead to start holding large gatherings and parties again. All of these are things that we've heard as questions or things that people want to do. First of all, the vaccine is not fully effective until the second dose. and not enough people in Delaware have taken it yet to give us widespread immunity, or what we call herd immunity. So please hang in there and continue to do the things that we know work. And with that, I am going to remind people that we do have our vaccine call center. They're very, very busy these days, but you can call them, especially during business hours, as well as on Saturdays, and also emailing them vaccine@delaware.gov. They will get back to you. And I will hand it back to the governor. Thank you.
Thank you. Thank you very much, Dr. Rattay, for that really important information. Obviously, one of the most important things, if not the most important thing, that the Division of Public Health and our partners have been doing since the onset of COVID-19, almost a year ago now, 10 months ago, back in the early spring, making sure that we get everybody that needs to be vaccinated in our state. We would encourage all of you to make use of the venues available. We're really focusing on those frontline 1A workers, anyone in the healthcare delivery area, hospital workers, primary care workers, all the various specialty healthcare workers need to get vaccinated. Our first responders were eager to get to 1B. I know those that are in 1B, particularly folks a little bit older than me and older, 65 and older, are eager to get their vaccine, and we are eager to get those vaccines in your arms. And so our focus right now, our sprint from now over the next week or two, is to get the supply of vaccines that we've already received in our state into the arms of Delawareans in that 1A group, to quickly move to 1B. We've been trying out mass vaccination sites like the DMVs. You saw the aerial view of the one effort there in Sussex County, a good venue with great partners to get lots of people through, getting vaccinated quickly and efficiently and effectively. Got to get people signed up and into the Delvax system. And we're going to ramp that up with additional mass vaccination sites as we move into the larger number populations of 1B and beyond. A large part of that's going to be an AJ Schall's effort already to add to the 100,000 to 200,000 testing that we're doing on a monthly basis. That's a lot of work to do. AJ, talk to us about testing and maybe a word about vaccinations with curative.
All right, sir. Thank you. And good afternoon, everybody. So we'll start actually with the hospitalization. So I know Dr. Tace touched upon this as well as the governor when we opened up. But again, we just wanted to share the graph that shows COVID patients, those that are being tested, the PUIs, and then non-COVID. So as much as we're hitting the high water mark right now for COVID patients, we hit the high number yesterday, and we know we're still in this post-holiday rush. We see the hospital managing their other capacity to really meet the demand of the COVID patient. So it's a good and bad situation. As we've heard before, it means they're managing what they need to with the COVID patients, but it also unfortunately means there's probably people with delayed care. So this is why the mitigation efforts put out, making sure people get tested, making sure people know their status, making sure they stay home when they're sick is so important, because we don't have much flexibility here of other things to do without having a ripple effect across the health of the state. So something we just wanted to share so you could visualize where we are today compared to, the last few weeks, is that 470 number is now the high water mark. Going into testing, again, a very busy December, as the governor alluded to, over, between the last week of November and first day of January, over 200,000 tests. We did see a little dip there with the holidays. We had a snowstorm in there as well, but it looked like once we got back to work post New Year's, definitely back on board. 57,000 numbers look pretty consistent this week. So we expect to be in that 50 range as well. Going to the individual testing sites. These are the pop-up, walk-up, drive-through sites that we have across the state. These do not include the DPH clinics or Walgreens as well, but we have 16 in Newcastle County between now and few less now because it started yesterday from this PDF, but 16 this week in Newcastle County, and then 8 in both Kent and Sussex. Geographically, we're trying to get a net across the state. These are one aspect. People have to get tested. Go to de.gov/COVID/get tested to see the map. The team over at Department of State did a great job updating the website a few weeks ago to really make the locations and options for testing even a little bit more flexible for people to wait. So as we see these high water marks of 200, we know it's not all from Wacom. We have a lot of healthcare partners, whether it's doctors' offices, whether it's clinics that people are going into to get tested. So there is ample testing across the state. However, we're still supporting as much community testing as possible to make it as easy and accessible for people across the state. And do not forget the at-home option as well. So this is great if you're able to schedule it. We've used this with the teachers. We've used it with different employee groups across the state. It is a very flexible, at your pace option that I think we've seen increases in. Then we saw a little decrease the last few weeks, but it's very flexible. We did see a little longer turnaround time in those processes with the holidays, with having to have it shipped to you, then ship it back. That did increase it a little bit with the rush of everything around the holidays, but that time has been decreasing the last 7 days. So we're excited about that. And then so that's the slides for testing. The governor asked to talk about the Curative partnership. We are looking to expand that. The goal is to have Curative have 3 sites across the state that would be available as we increase vaccination more. I'll tell you what, there can't be more kudos that go out to Dr. Rattay's team and the public health team for doing these pods or these drive-through events the last few weeks. We thought, that testing was labor intensive and complicated when we started this back in May, and vaccination just has, it just magnifies that with the number of steps and partners that it takes. So, kudos to Dr. Rattay's team. We will be bringing on other partners to provide that as well. So more to come on that probably in the next few days as we understand what our allotment is through the federal partners as well, Governor. So back to you.
Thank you very much, AJ. You're right. It takes a lot of people, a lot of partners to test 200,000 folks a month. It's been critical in our efforts to know where the spread is occurring, how widespread in our community, so individuals can know their status, so that they can quarantine themselves, so that they can alert their family and friends and others that they've come in contact with over a period of time. We do have the ability with the app that you can put on your phone, COVID Alert. We would recommend that everybody download that. It is voluntary. It is anonymous. We're not out of that stage yet. We still need to take precautions so that we can reduce this spread. We can reduce the number, the transmission that goes from one person to another, and therefore reduce the spread throughout our community so we can get safer, so that we can get more children back in school, so we can get our essential workers back working with a greater sense of safety there, and so that we can get back to things more in a normal basis. We also need to make sure we're getting people vaccinated. This is going to be probably the biggest bigger challenge, a little bit more complicated than testing as it turns out. So all the foundation of partners that we're developing and that have been in place for flu testing for some time is going to be critical, but we're also going to need the ability and capacity to vaccinate large numbers of people at large venues at a big rate. We're seeing that in other states. Lots of examples in our region and across the country, what states are doing to respond to that imperative. So that'll be, that's on our list of things to do, and we'll really be focusing on that in the days and weeks ahead. So I think that's it. We have media on the call and a handful of pre-submitted questions that we're ready to take at this point. Thanks for joining us today.
All right, first we will go to Nick Ciolino from Delaware Public Media. Good afternoon, Governor, Dr. Rattay, and Director Schall. Thanks for taking my question. To start, I'm curious if Delaware has seen the other variant of the coronavirus in the state, and if we know, and if we have identified the other more contagious variant, does that change public policy in any meaningful way?
Dr. Rattay?
Yeah, hi, Nick, and thanks for that question. We are certainly looking for it. We have not found the variant yet. I won't be surprised if and when we find it, because multiple other states now have found the UK variant. So our laboratory is has a technique where they can screen to identify whether a particular specimen needs an additional analysis, which gets sent to CDC. Again, we haven't identified it yet, but we are looking for it. The implications are concerning in that although it does not cause more serious illness because it's more contagious, we may, if and when we begin to see spread of it, it's certainly possible that we'll see a higher level of infectious spread in the state. So, I mean, there's potential for another surge with that. So we're keeping an eye on it, and it's hard to say what policy implications will be in play. But as the governor has said, it is all the more reason to try to get vaccine into people's arms as quickly as possible. And again, the same mitigation strategies of face coverings and social distancing work for this variant as well. So we really have to stay the course, and we'll keep our eyes open.
All right, and then I noticed on your slide earlier that 42 of the state's 4,685 long-term care facilities have received the first round of vaccinations. Is there a chance that the rest of them will not receive that first round until after we start the 1B vaccinations? And then would that be at all in conflict with the state's initial plan?
Oh, that's another great question, because we've never seen our phases as distinct, where you must finish one before you move into the other. We see them really as overlapping phases. The schedule right now puts all of the the high-level long-term care facilities in January for their first round, which we're happy with. But we are eager to move into 1B. So after this 1A sprint in the next week and a half, we're really working to move on, even though not all well, at that point, most facilities will have gotten their first round. But again, these phases aren't cut and dry. We're going to keep moving forward as we have vaccine available.
All right, next we'll go to Sarah Gamard from the News Journal.
Dr. Rattay, this question actually kind of relates to what you just talked about. It was reported today that the federal government is asking states to speed up vaccinations to people over 65 and others at risk instead of holding back vaccines for a second dose. Is Delaware going to start offering vaccines to phase 1B and stop holding back second doses in accordance with the new national guidance?
Yeah, so we're certainly having discussions around this. What we do know is right now the science, is supportive of 2 doses. And so we don't want people to not get their second dose. And I want to emphasize that. But we also, especially, in the midst of the levels of infection we're seeing right now, we want to get this vaccine into as many arms as quickly as we possibly can. So again, the track we're on right now, what we're calling our sprint to finish 1A, or at least to give all of 1A an opportunity to get vaccinated so that we can move on to 1B as quickly as possible is really our focus.
So my second question, private practices have said that hospitals told them initially that they were not allowed by the state to vaccinate them, but then recently reversed course after being told by the state that they could do so. Are hospitals offering vaccinations to people in phase 1A outside of their own employees? And if so, when did they start doing that?
So for the first part of that, I'm not sure where that confusion came from. In our task force meetings, we've always suggested to the hospitals that we would like for them to go outside of the walls of their hospitals and partner, especially with other healthcare providers in their network, to get the providers and their staff vaccinated. So we are heartened, and AJ has been talking very closely with them, as has the governor. Some may want to add more, but they are certainly, and several of them have been vaccinating outside of their walls from near the beginning of the vaccination campaign. But they're all looking at opportunities to make sure that the partners in their network have options. AJ, I don't know if you want to add to that.
Well, I'll just add, Sarah, we've had meetings on this, and we were helping the hospitals in a number of capacity to make this happen, a number of efforts. They've worked very tirelessly kind of from right before the holidays through now to get their staff vaccinated, and it started some of the second doses. Just this morning, we had a call with all the hospital systems in the state. I guess the best way to summarize is we're helping them play matchmaker with providers in their area that are unable to vaccinate their own staff. All of them have done at least some people, but we're actually increasing or redirecting allocations of vaccine to help speed that up. Again, Diane Hainsworth's team over at DPH is doing a good job behind the scenes, breaking down who needs it and getting that to the individual hospital systems so they could reach out. But I'll tell you, by the end of this week, each hospital system is going to have multiple clients on the book to make this happen. This is one of the things that has to happen for us to get the sprint through 1A. And, I think it's just, it's making those relationships behind the scenes. So absolutely happening. It's been happening. I can't tell you what day the first partner went outside their doors, but we're just helping them and trying to speed it up and provide them more vaccine when it's available.
Sarah, the imperative for me is to ramp up the throughput in vaccinations. And right now we have more supply than we've been able to distribute. And so what we've tried to get from the hospitals and others is their capacity, their weekly capacity to put needles in people's arms. And that's what AJ's been working on. We have good partners there. They are reaching out into their communities. They were a little bit slow to start, as were we, but we're ready to rock and roll now. And we've got this sprint going on over the next couple of weeks. And we expect with the new Biden administration to get more supply, and we need to be ready for that.
Next, we have Amy Cherry from WGEL.
Hi, Dr. Rattay. You kind of touched on this a little bit, and it's sort of an offshoot of Sarah's question, but I'm wondering if you're worried about the federal government's plans to change the COVID vaccine allocations and how it could affect Delaware's future vaccine supplies, since our data is currently showing that reporting lag, and then also less than half of the shots are currently in arms. Is 2 weeks time enough to really turn that around?
Yeah, so we have a lot underway right now to accelerate administration of vaccine, reporting of vaccine to make sure it gets into our system, but also really ramping up opportunities. We've talked about 1A today, but for future phases as well, which we're really eager to move into. So, I think the governor stated it very well. I mean, we're really working on high throughput options to try to move vaccine quickly, but we also want to make sure people have options that personally make the most sense for them. And I think we're really excited about the infrastructure that has been built now in Delaware to provide those options. But we're eager to get more vaccine and to move into our next phase and to get more people vaccinated.
Thank you. Second question. We're hearing a lot of confusion from the public, particularly among that 65 and older age group who won't be getting the vaccine from an employer, but they're also not in a long-term care center. We've received several calls from people saying they call the vaccine hotline, they tell them to call their PCP, they call the PCP, they tell them to call the vaccine hotline. How do you plan to make this more clear for people in the coming weeks?
Yeah, so we do plan to make this super clear for people in the very near future. What we've been trying to communicate is that there are going to be multiple options for you to get vaccinated. It's not time yet for people over 65, and we promise that we will have instructions around those options. You know, we've suggested that people check in with their primary care provider because many of them are providing vaccine. And for many people, that's the preferred place to get vaccinated. But if your primary care provider is not going to be providing vaccination, or your other providers, for example, your cardiologist or your oncologist, then we really want to encourage people to keep an eye on our website, as I mentioned, and keep an eye on our announcements. And there's going to be a lot more information about pharmacy options as well as these vaccination events very, very soon.
What's clear is that we're going to need the high throughput vaccination centers in order to meet the demand out there.
All right, next we have Tim Mastro from Delaware State News.
Hi, everybody.
Hello.
Quick question on, so with vaccines in regard to assisted living facilities, are they classified as long-term care facilities as well? And how has the vaccine made their way into those facilities yet?
Yes, great question, Tim. So the assisted living facilities are a part of those 188 facilities. So all assisted living facilities have had an opportunity to be a part of that federal pharmacy program, and I believe they've all signed up. So for staff and residents in those facilities, they're on the same trajectory as our higher level facilities.
All right, and just to follow up on that, so with the federal pharmacy program, are they just kind of at the mercy of like CVS or Walgreens in terms for when they can get the vaccine, or does the state have any impact on that?
So this is completely a federally run program, but CVS and Walgreens, they were assigned to different facilities, and they've scheduled visits for all these facilities. So that happened relatively quickly once the program was activated, and so now they're doing their job to visit the facilities and administrate the vaccinations.
All right, next we'll go to our pre-submitted questions. First, we have a question from Melissa Steele at Cape Gazette. She asks, is there any further information from the FBI that warned of an armed protest in the state capitol? Do you know who's behind the protest, and has there been more security sent to Dover in light of this?
I know that the Delaware State Police and the DIAC that provides information of these kinds of threats to Delaware State Police and local law enforcement is aware of these threats and tracking them in our state. There's been conversations coming with leaders in the General Assembly about the threats, and will be something that we'll be following in the days and weeks ahead.
Next question is from Mary Lou at WGMD. Looking at the number of vaccines already given and the total amount Delaware has received, it seems the remaining vaccine is enough for the second dose for those who have already received it, with the 256 as a pillow. Is Delaware expecting a windfall in new shipments this week? According to the tracker, it's been nearly a week since we received additional doses. And is the third supplier any closer to joining Pfizer and Moderna?
Let me just say two things and then hand it over to Dr. Rattay. As we've been saying throughout this call, we need to increase the throughput to get more vaccines in people's arms with the supply that we've received. We're reserving, our partners are reserving, and we are as well, second vaccines for those who received the first, because that's a critical part of this effort. And we'll continue to do that, at least in the short term. But we need to increase the throughput, particularly as we move into the next larger category of folks, particularly those 65 and older. Lots of questions around that. We'll have answers in the days ahead, and we're in this sprint right now to put into arms the vaccines that we've already received. Dr. Rattay, any of that, including the last part about maybe a third vaccine coming?
Yeah, to add to the first part of the answer, because Mary Lou noticed that the allocations that we received in the last week from the federal government were relatively minimal. We are, a large proportion of our allocations right now are going to this federal pharmacy program. And so they still are coming to Delaware, but they are going to the long-term care facilities. And so not as much as coming in for our discretionary use at this point. That will increase and change as we move forward. We are certainly eager to get more information about when our second dose is and how much is coming to the state, but we're certainly getting indication that we will be receiving a lot of second doses at the same time shortly. In regards to what vaccines are next around the corner, in addition to Pfizer and Moderna, we just don't know right now. There are no other vaccines that have completed clinical trials or submitted for emergency use authorization. There are a number in that clinical trial pipeline. We have, the federal government has indicated that it will be spring before we see a third vaccine coming our way. But certainly we will keep our eyes open and are eagerly awaiting even another option.
And I just have one last question that just came in. It's from Laura Walter at Coastal Point. She asked, do the COVID vaccines differ from others in terms of how they're administered? Just clarifying if there's a different needle than other common vaccines.
So the needle is pretty much the same. Every vaccine is different, how you store it, how you swirl it or shake it, and how much you draw up. Do you put it in the muscle or do you put it just under the skin? So this is actually even a little bit different than flu vaccine because it's put in the muscle and not subcutaneous, but it's nonetheless, it's, much of the logistics are relatively similar. These are a little bit more complicated because of the cold storage, the ones we have right now, but otherwise, most of the logistical components of this are similar.
Thank you. That's the last of the questions.
So again, thank you to those from the media who joined us on our press conference today. Thank you to the public for joining us as well. As I travel through the community, appropriately socially distanced and with my mask on, of course. I run into people all the time who talk about tuning in to our weekly updates on COVID-19. Obviously, as we start the new year, we're fighting the virus on two fronts, and with another major objective being to make sure that we get more children back in school for in-person instruction. And again, thanks go out to all our educators in the districts for doing that, for taking the time over the Christmas, New Year's holiday, an extra week on either end, for the planning, for information sharing, for getting people a greater comfort level. We will continue to support our educators in every way we can, and everyone trying to help educate our children. Our testing efforts have ramped up to an incredible level with over 200,000 tests being delivered in a given month at a critical time, November, December, and now almost halfway through January, just racking up big numbers. We need to get the same place with our testing, and we'll ramp up. It's going to be a big challenge, a little bit more difficult and more complicated than the testing side to get people vaccinated. But it's something that we certainly can do. It's our way to get to the light at the end of the tunnel. It's a way to make our community healthy. So that we can get our economy back moving at full bore again and get people back to work and back to business in a more regular way, so we can get all of our children back in school and to all of us living safely. But that, again, is going to require all of us to pull together on the testing side, on the disease mitigation side, the mask wearing, social distancing, keeping away from large gatherings. It's going to require us to get our vaccine when the venue is available. The onus is on us to ramp those opportunities up, and we will do that. We've got a sprint right now going on with the vaccines that we've already received, and we've got help hopefully along the way with our partner Curative, who's been a great partner with the testing side and enabling us to do larger numbers on the vaccine side. So we'll have more information for that 1B group. Very interested in knowing when their number is up. We look forward to that day and that time. Thanks for joining us today.